This is Indian Country Today.
Thank you for joining us. I'm Mark Trahant. Here are the headlines from Indian Country Today. Several youth from the Standing Rock and Cheyenne River Sioux Nations are running a 93-mile relay race to the Cannonball River, all to protest the Dakota Access Pipeline. The run in North Dakota is being organized in part by the Standing Rock Youth Council. Katie Peltier is Lakota and Ojibwe. She says they picked a run for a specific reason.
That running not only is something that can lead to a really healthy lifestyle, but it can unite a lot of people from all over. And then when you do a run, obviously it kind of connects all of the communities.
The youth are being supported by hundreds of Indigenous leaders, environmental groups, and influencers. They are calling on President Joe Biden to stand with Standing Rock and shut down the Dakota Access Pipeline. Alyssa Marshall is also a part of the youth group and thinks this is their time to shine.
I really think that this is going to be an important movement for everyone because we've been fighting for over 4 years now, and this is going to be our time to finally put a stop to it.
A federal judge is asking the Biden administration to appear in court on Wednesday. On the docket is a decision by the administration to shut down the pipeline while the court-ordered environmental review is conducted. More than 200 researchers are signing a letter requesting more Indigenous input into a national Arctic initiative. One of the National Science Foundation's flagship initiatives for the past few years is called Navigating the New Arctic. The initiative looks at the effects of a warming climate on Arctic communities. However, some in the field believe the foundation isn't doing enough to involve Indigenous people who live there. The letter from researchers was formed in solidarity with another letter sent last year from Karok Incorporated, the Association of Village Council Presidents, the Bering Sea Elders Group, and the Aleut community of St. Paul Island. The joint letter outlines several issues that could have been studied in a more in-depth way if traditional knowledge on food security and community foundations were included from the start. The tribal organizations also highlighted problems with the request for proposals. North Dakota lawmakers are hearing a bill that requires a 4-week course to be taught on Native American history, culture, and treaty rights. Last summer, Bismarck Public School students learned about smudging, talking circles, and other aspects of Indigenous culture in the region. Billy Jo Beheeler is a parent, and she says she sees the potential for all students to learn.
I believe that it will be monumental for students to be able to see curriculum that teaches us about the special federal Indian relationship that we have with the United States government.
Though not everyone who provided comment at the committee hearing agreed, the bill would be beneficial. 12 of the 15 people who spoke were in favor of it. The San Manuel Band of Mission Indians in Southern California is hiring. The tribe is looking for more than 500 people to fill casino jobs. This is in preparation for Phase 1 of their ambitious casino and resort expansion. This virtual career fair expo kicks off San Manuel's massive 10-month recruitment initiative. Casino management will hire more than 2,000 permanent full-time people by the end of the year. Hiring in a pandemic comes with a unique twist on social distancing. Job seekers are invited to San Manuel's online career fair expo, where they can explore career opportunities by visiting virtually with hiring managers, book on-the-spot interviews, and browse a collection of videos to learn more about what it's like to work at San Manuel. And speaking of Indian gaming, Arizonans may soon be allowed to bet on professional and college sports at tribal casinos and at sites owned by pro sports teams. The proposal helps update the state's gaming compact that recognizes tribally run and regulated casinos. Introduced in the Arizona House, it would also allow online bets, fantasy sports wagering, and add limited Keno games at off-track betting locations, as well as social clubs like the American Legion. Introduced by Representative Jeff Winnegar after Governor Doug Ducey announced the need for a modernized gaming compact to bring more revenue for tribal nations and to Arizona's budget. Winnegar says it will bring an unknown boost to the state's revenue. And those are the headlines from Indian Country today. I'm Mark Trahan. When we come back, Abigail Echohawk speaks to us about COVID vaccines. The first ever national data regarding Native people's view toward COVID-19 vaccines are out. The results are surprising. 75% of study participants say they would be willing to receive a COVID-19 vaccine, higher than the national average. The October survey says 64% of the U.S. general population was willing to receive a vaccine. American Indians and Alaska Natives from 46 states were surveyed, representing 318 different tribal affiliations, and to assess hurdles they face in accessing healthcare and resources. We are now joined by Abigail Echohawk, who is Pawnee. She serves as director of the Urban Indian Health Institute and the chief research officer at the Seattle Indian Health Board. Welcome, Abigail.
Thanks for having me.
What did you find most interesting about from the study, and what that you found?
This study was one that we saw as imperative to do in Indian country. Right now that we know that all of the materials, all of the information coming out about the vaccine that's coming into Indian country hasn't been informed by our voices. So this study was important for us to do to ensure that the views of Native people were properly heard, that our voices were part of ensuring that we get the information we need on the vaccine. The thing that I think surprised a lot of folks that I was not surprised by is that 74% of all of our participants said that they were making this decision on behalf of their community, their tribe, their family. Whereas when you look at the rest of the population, and they've done and asked that same question in African American communities and Latinx, Hispanic communities, and also in white communities, and we found that to be much lower. And in fact, in the African American community, when asked that same question, are they doing it because it's an individual choice, or are they doing it for their community? That Latinx people, only 53% of them said they were doing it for the community, and only 36% of African Americans said they did it for their community. And that is, as a Native person, that's why we make our choices. That's our ancestral tradition, is to take care of each other. We are already public health organizations and people caring about our communities. So that was a real surprise to my partners at both the federal and state level, because they've been shaping all of their materials, focusing on what it means to make this decision as an individual, which means most of the information people are getting isn't going to meet the needs of Native people. So this survey was really important for us to do to make sure that Native people got the information they need. And so we've actually launched a vaccine health communications, letting everybody know what the vaccine's all about. And we're calling it Be a Good Ancestor, because we know that we have a responsibility to be a good ancestor to those next generations.
And this information is so critical, Abigail. And one thing, I just have to give you both a shout out and raise a broad question, and that is we all know there's just not enough research and data. And almost single-handedly with this and with missing and murdered Indigenous women, you brought back, let's just say it, you've made data cool.
Well, I think it's cool. I feel blessed every single day to come in here, and thank you so much. And I think about our ancestors who, all the stories that we know, all of the information in our art, we have always have been data carriers, and it's our responsibility to reclaim that ancestral tradition. So I feel blessed to be able to do that here at the Seattle Indian Health Board.
Why do you think, we see with this, the data showing basically the values that we carry going into this conversation, and you're using that in your advertising. Do you think that will affect people getting the vaccine sooner?
Yes, I think for Native people, those value systems, which we were taught by our elders, by our parents, by our grandparents, and thinking about we always take care of those next generations. We care for our elders. We think about our youth. That is innate within us. And so if we're going to be really working towards getting our people vaccinated, really telling them how they are part of ending this pandemic in our communities has to be what we're focusing on. And in fact, we're doing this better than the rest of the United States. When we think about across the United States in big communities where they can't even get people to wear masks, where people are like, this is my decision, it's an individual decision. In Native communities, we have more mask uptake. We have incredible public health precautions that went into place before anywhere else in the country. Stay-at-home orders, checkpoints on roads. We have done better than the rest of the nation on working to end this pandemic because we knew that our communities mattered that much. So we're making these decisions on behalf of our communities. And if we are framing what it means to get the vaccine in that way, we are more likely to see greater uptake of the vaccine within our communities. And it's going to take all of us to end this pandemic and taking all of these precautions.
Well, and we're hearing lots of anecdotal evidence that just backs up that very statement that our communities are doing better, especially with the vaccine. Some of that is because, one, people have been through pandemics before and know what the results can be. And two, we have a system in place.
Yeah, we're really fortunate. We have a system in place. And as public health communities, I keep telling all of my friends in the state and federal levels, like, you should have asked an Indian on how to do this a long time ago. We know what it means to communicate to our communities. We know who our priority people are. We are always going to take care of our elders and youth. We know how to reach them. And the states and the counties right now don't know how to reach those who are most at risk for getting COVID-19 and dying from COVID-19, but we do. So nationally, when we've seen the vaccine rollout, Native communities are doing better. Here at the Seattle Indian Health Board, we have actually been able to expand and vaccinate more people than other places have done because we've already vaccinated majority of our high-risk Native people in the county already. So now we've expanded that to lower age groups, and we're not the only ones. We're seeing that nationwide in tribes and in urban Indian communities. I really believe that folks need to quit coming to us because they think we have all the problems and all the issues. They need to come to Native communities because we have the answers, and it's being shown in how we are rolling out the COVID vaccine right now in our communities.
Well, and that's actually why I use the word system, because as we look at the U.S. healthcare, there are a lot of lessons we can learn from a system approach to how we do all healthcare, not just pandemic.
Yeah, absolutely. And it's one of the reasons with the new Biden administration, with Congress, we need to make sure that our Indian healthcare system is fully funded. Despite our ability to do well in this vaccine, we know that our clinics don't have the resources we need. The Indian healthcare system is chronically underfunded. We're going to see the new appointment, hopefully soon, of a director of the Indian Health Service. But I'm tired of saying, this director does a great job with the little resources they have. What if they had all the resources? What could our system look like then? We could boost up the programs that are doing extremely well, like was just shown in the vaccine rollout. What if we had the resources? And Indian country turned out for the Biden-Harris administration and they voted for them. Now it's time for them to show up for us.
One part of that funding equation could be Medicaid. Is this the moment to reform Medicaid?
I think there's absolutely opportunities to do that and to really increase that third-party billing for Indian healthcare programs, tribal programs, urban Indian health programs, and really give us the boost we need. I know for some of the programs across the United States, particularly the urban Indian ones, who serve also non-Indian the families of the people that they serve, that we're fighting scarce resources. I've been hearing from clinics across the country about how their phone systems are crashing because they've never had this volume of calls before. Any kind of reform that allows for us to properly bill, to get the reimbursements that we need to reinvest into our healthcare systems is going to be key, especially for Indian country, where we have seen the greatest lack of funding and resources since the inception of the Indian Health Service.
Well, and you know every day how urban Indian health becomes really the low part of this whole equation. Is that where the resources should go first?
I think they need to go to everybody. With the chronic underfunding for the urban Indian health programs, we never want to take anything away from the tribes. The tribes desperately need every bit of that money. What we're asking is for a larger pie, not to distribute the pie that we already have into more pieces. We need to have that invested across Indian country. For the urban Indian communities right now, where approximately 70% of Native people live, we are seeing that our Native people are not getting the access to resources. There's not an urban Indian clinic in every single city across the United States. And so our people who are at the highest risk for COVID-19 are not getting access to the vaccine, and we're really worried about it. In the data, it's being effectively hidden by the way the states and the federal government are reporting out the data. And our people are desperate right now, and our people are dying. So if we don't get more resources, unfortunately, we're going to see more people die. And I know that across Indian country, we have refused to allow that to happen in silence. So the more that we advocate, raise our voices, and ensure that we are fighting for the resources for our people, and the more that we can do that together across urban and rural communities, the more we can serve our communities in a way that ensures that we are being those good ancestors for the next generations.
There's an old saying that you change what you measure. How do we change the way we measure populations, especially to get the data we need?
Right now, it's a huge issue. It's one that keeps me up at night. I've had some recent deaths from COVID-19 in my family, of dear friends. I had a dear friend that passed away just 2 days ago. And I remember sitting on my couch with that first death thinking, is their last story, the death, is that even captured? Are they being able to tell that story for Native people? Because we know that the data is not being captured. These systems of the way data is captured on both deaths and also on infections of COVID-19 and all kinds of health across the country has never properly captured American Indians and Alaska Natives. We need an absolute complete overhaul of the public health surveillance systems which capture this information. And the Urban Indian Health Institute is part of a national collaborative called We Count that is pushing for that includes other people of color, large surveillance, public health entities, as we're calling on Congress and on the Biden administration for the very first time, invest in public health. If we don't revamp these systems, our people are going to continue to die, and their deaths won't even be the last story that they're able to tell.
We have less than a minute left, but what's the takeaway from the vaccine story right now?
I think the takeaway is Indian country is doing best. Get this vaccine because you are being a good ancestor to your community. And also, if we are not using information and voices from Native people through the data, we are not going to be seeing the vaccine uptake, nor the prevention of other kinds of health diseases that we need to see in our communities. So make sure that we're participating in these data gathering efforts and fight for our people every single day, whether it be through prayer, through community gatherings, and also participation in your tribal and urban Indian communities. So it's together that we're going to end this pandemic.
Thank you, Abigail Echohawk.
Thank you for having me.
When we come back, we'll visit with Indians.com managing editor. Kevin Aberest serves as managing editor for Indians.com, a Native American news website. He has spent 21 years as a professional journalist, including 18 years as a reporter and editor for the Lincoln Journal-Star. He is an enrolled citizen of the Rosebud Sioux Tribe and a married father with 5 children. He lives and works in Lincoln, Nebraska. Indians is owned and operated by Ho-Chunk Inc., the Economic Development Corporation for the Winnebago Tribe of Nebraska. Welcome, Kevin.
It's great to be here, Mark. Thanks for having me.
So you're in a really important part of the world where there's a lot of issues going on right now, particularly in South Dakota. Maybe lay out the landscape for us, what you're seeing as you write about some of these issues.
Absolutely. Yeah. So obviously the past 4 years have been pretty interesting nationally. And certainly that's been the case in Indian country, as you know. In South Dakota, over the past year or so, especially since the pandemic began, there's been a lot of tension between, the tribes there, especially two tribes, the Oglala Sioux tribe and the Cheyenne River Sioux tribe, and the state government there, primarily the governor of South Dakota, Kristi Noem. Both those tribes attempted to set up, I guess you would call them either checkpoints, I guess, or, I guess depends on who you're asking. Some people might call them roadblocks, but I would certainly call them checkpoints. And those are places on the periphery of the tribe, on major highways leading onto the tribe, where the tribe would stop people as they're entering the reservations in order who it was that was trying to enter the reservation, just to see if, they were bringing COVID-19 with them, if they were sick. And oftentimes, even if they weren't sick and they were coming from a place that was where a lot of the disease was being spread, they would ask them to go around the reservation. The state of South Dakota, Kristi Noem didn't like that and attempted to get the tribes to take down their checkpoints, and even petitioned the federal government and Donald Trump to force the tribes to take down those checkpoints. But that issue had been adjudicated many years before, and several court decisions had really given the tribes permission to establish those kinds of checkpoints and protect their borders in that way. So those checkpoints were never taken down. In fact, if you travel onto those reservations today, you'll have to pass by those checkpoints. I would say that, that probably exacerbated some racial tensions between those reservations and the surrounding communities, but perhaps the inability of Donald Trump to win re-election may have caused things to worsen as far as relations. It's hard to say. I mean, but what we're seeing now is that there are a number of racial incidents that have been occurring, especially on the Pine Ridge Indian Reservation. I've talked to a number of people on the reservation who described several racial incidents, including a woman who was allegedly attacked on a back road between Chadron and Pine Ridge in about mid-January. And she said that the people who attacked her were in a pickup that was flying in a Confederate flag. Now, she refused to talk to investigators later on. She told one of my sources that, she was just scared to talk, that she lives in the same community as those people and they know where she lives and she doesn't want to say anything. So she didn't talk to investigators about that. So these are just, at this point, allegations. Another incident happened within the past couple of weeks. There were two signs on the reservation leading onto the reservation that were defaced with anti-Semitic imagery and statements. The word KKK was written on these welcome signs. It's basically welcoming people to the reservation, and the F word was used, and F Biden, I guess, was what was written. And there was a Nazi swastika that was painted over one of the tribal flag symbols. So these things have people concerned. There've also been a number of incidents in Rapid City, which is about an hour and a half northwest of the Pine Ridge Reservation, where a number of Native people live, especially Lakota people. There was a woman who was approached in a bar, and a white woman came up to her and her Native friend and basically called them and that was videotaped, and there was also some anti-Native words that were spray painted on a window in downtown Rapid City that said, "Go back to your reservation." So these things, I mean, they probably happen a lot more than we think, but certainly it seems like they're on the rise right now. There've been a lot of other issues that may be causing this in Rapid Cities, especially. There's been a lot of tension between the city government and a number of local activists who have attempted to set up a teepee camp to protect homeless people there, homeless Native people, but other homeless people as well. The city took down that teepee camp, and those activists were forced to find other places to set up a teepee camp, and they did. They're actually able to get a number of tribes to donate them some land, or at least let them use some land just outside the city borders there, beyond the control of the city government, luckily. And they've set up a teepee camp. They set up a homeless teepee camp. In fact, they're using these Arctic army tents to house homeless people there. So, I mean, it's hard to say, of course, what's causing these kinds of incidents. But, a number of people I've talked to feel like these are situations that have been exacerbated by national issues and tensions between the state and tribal governments.
Kevin, we have about a minute left. What are you working on now?
Right now, I'm working on a story. I'm working on a number of stories, but one of those stories is just looking at the efforts of tribes in South Dakota to really attempt to fight, obviously, COVID-19 and address many of the obstacles sort of facing them and trying to get vaccinations within their tribal members and off-reservation members, and anybody, I guess, who needs it, who comes to their hospitals. So obviously, there are the number of obstacles facing Native peoples in that regard.
Thank you very much. Kevin Abresk, managing editor of Indians.com.
I appreciate it, Mark. Thank you.
And that's a slice of our Indigenous world today. Thank you for watching. We'll be back with another edition tomorrow. I'm Mark Trahant.
Indian Country Today is recorded at the Phoenix Indian School Visitor Center in Phoenix, Arizona.
This is Indian Country Today.